I have I think a quick question. So I have an illness and I got surgery and I don't know if I can like do Ramadan. So I asked the the doctor, but he's not Muslim, so he said, I don't know. Try. What should I do?
Okay. Well, if the doctor said, I don't know, and try, that means it is not something really harmful for you. Because basically, I guess you explained to him that you will not be able to eat nor drink from dawn till sunset. You're calling from the Netherlands, right?
Exactly.
Daytime is kind of short right now. It's winter. Am I correct? How many hours of fasting? 14?
It's from 6 till 5:30.
That's about less than from 6 to 5:30. That's 11 and a half hours. Am I correct?
Yes,
Okay.
I think.
Which is not bad. Are you on any analgesics or anti-inflammatories or a medication where you have to take like 3 times a day and so on?
Yeah, I have to take medication before eating.
No, I'm
But
talking about the medication which you take after meals as antibiotics or analgesics or anti-inflammatories.
No. So I had surgery last year, but I still have to take medicines because I'm still in risk,
Yeah,
and
mashallah,
I take them once a
surgery
day.
since last year, alhamdulillah, that means you've recovered. Listen, if one more time, call your doctor and ask him this specific question. I will stop eating and drinking from 6 a.m. till 5:30 p.m. Does this pose any harm on my health? Am I required to take medications during these times? Okay? Or do I have to drink certain amount of liquids? Would that cause any harm to my health if I don't do that? If he says yes, and you should not fast, you should eat, you should drink at least twice a day and take the medication before and after meals, you're eligible to skip fasting. But when the doctor said yes, you can try, that means it is not really urgent, you know? So double check with the doctor once again. If he says it is okay and you can try, then you should try. Thank you, Aya from Netherlands. Barakallahu fikum. I'd like also to tell the viewers that we differentiate between two types of diseases and sickness. There is a disease with which the person have to skip fasting, but the doctor said it's only for a couple months, then inshallah you will feel better. In this case, there is no fidya. You don't feed, you don't pay anything. You wait until you recover, then you start making up the days which you missed during Ramadan. Versus the second case, which is chronic diseases, where somebody developed renal failure, God forbid, hyper or hypotensive, severe hyper or hypotensive patients. Doctors whom they say that unfortunately there is no recovery, but you have to live with the medication and you have to eat on regular basis, you have to drink, take liquids, whatever. So such people will be eligible to skip fasting, and instead of making up, because it is not expected from them to make up the missed fasting, they would rather do what Allah the Almighty said, fidyatun ta'amu miskin. So after Maghrib of every day, now they can feed one miskin. Or they can wait until the end of the month. If the month happened to be 29 days or 30 days, they can feed 30 masakin, one meal, and that would be sufficient. They can also wait 3-4 days and feed 3-4 people, 10 days and they feed 10 people, and so on.